Okay, as always, we start with infection control, so washing our hands. So when you walk into a patient's room for the first time, as a novice learner, sometimes you kind of forget to check the environment. So we're going to go over 7 things that you really want to look for when you walk into a patient's room. So the first thing you're going to look for is lighting. So you can see that the room is a little bit dark, and sometimes as a new learner, you're hesitant to turn on the light. You're worried about waking the patient, but at the same time, you actually can't do an assessment unless you have good lighting. So let's turn on our lights. There's 1, there's 2, and then you also have lighting over here at the bedside. So then you can really do a good assessment. You have different levels, so if your patient is sleeping, you can kind of start with the duller light, then as they're waking up, you can turn on the bright light to do a really good assessment. So lighting. The other thing when you walking into a room is noise. So you can kind of hear the noise in the background. Sometimes the TV is on, people are visiting, there's equipment that might be beeping, and that makes it really difficult for you to kind of really hear your patient. It's distressing for the patient, especially at night, if they can't sleep, if they're really tired, if they're in pain. So noise kind of exacerbates your discomfort. So not being afraid if things are really noisy for example, if the TV's on when you're doing blood pressure, to turn it off so that it's not interrupting your sound. Not being afraid to ask, visitors to keep it down, especially if they're in a shared room like this, and one of your patients is having a hard time sleeping and the noise is bothering. So not being afraid to control the noise, turning down the volume on your machines, etc. So lighting, noise, safety. So safety is a big one, especially in the hospital setting. So knowing what makes your hospital environment safe. So no clutter, so making sure that there's nothing in the way of your patient kind of getting safely from their bed to the washroom. Making sure that all of their personal belongings are close by. So, as you're doing your care, if you need to move things around, great, but always making sure that you put their belongings back within reach. This is an empty room, so your beds are kept at a raised height, letting people know that the bed is empty. But if you have your patient in the bed, you always want to make sure that the bed is in its lowest possible position and at least one side rail is elevated. So if they need 2 side rails elevated for helping themselves move up into bed, great. So easily just kind of making sure that you have the bed in its lowest possible position when the patient is in the bed. If you're doing care, you need to make sure that the bed is at your working height. But if you're going to do that, then you need to make sure that both side rails are elevated. So if the patient is in the bed and you're doing care, then working height is the safe position for you. But you want to make sure that both side rails are elevated. If the patient is in the bed and you're not providing care, then you want to make sure that the bed is in its lowest possible position, and you want to make sure that the brakes are on. Okay, so making sure, you also want to make sure that the call bell is within reach so that the patient can reach out to you at all times. So this is an empty room, so when you have your patient, making sure that the call bell is within reach for the patient to call for help as they need. Cleanliness. So you can see right now that this room is quite clean, it's organized. So not being afraid, there's nothing stopping you, as a novice learner, when you come into your patient care, to tidy up your patient's room. It creates a sense of comfort the cleaner your room is. So if there are things on the bedside table, don't be afraid to organize those. putting organizing the belongings, cleaning up any, old food, not hesitating to put that in the garbage. So keeping your rooms nice and clean contributes to the comfort of your patient. Odors. So hospitals can have all kinds of different odors, and you really want to be aware of any strong or foul odors and not being afraid to do something about that. So if you have to do peri-care and you have to get rid of, it depends, in the garbage, then go ahead and empty that garbage can. We have a kind of natural odor absorbers. So if it's a really foul odor, not being afraid to come in and just kind of keeping the room odor free. Because again, that's quite distressing for the patient to have to sit in strong odors. So what we talked about, lighting, we talked about noise, we talked about safety, cleanliness, odors, room temperature. So of course you can't see room temperature, but if you walk into a room and it feels excessively warm, then ask the patient, it feels really warm in here. Do you need to turn down the heating? Do you need to open a window? Is this excessively cool in here? So you might think it's really cold, but the patient might enjoy it at that temperature. So always check in with your patient. If it's excessively cold, offering them a sweater, a warm blanket, turning up the heat. And last but not least is privacy. So when you're walking into a patient's room, ensuring that you're maintaining privacy in all the appropriate situations. So if your patient is in a 2-bed ward and you have to interact with your patient, and this is even just for private conversations, is not being afraid to pull the bedside curtains. If you're providing care, making sure that the curtains are closed while you're providing care. If you're talking about delicate topics, is either finding a more private space for the patient or keeping your voice at a level so that not everyone is hearing your conversation. So those are kind of your environmental scan. So the things that you want to look for are those 7 factors when you walk into your room for the first time. So lighting, noise, cleanliness, safety, privacy, odors. Did I get them all? Okay, I hope this helps.